Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD, DOM, Florida. And we've been talking about some things. Last week, we did a show where I talked about treatment with music. And, it's all part of addressing things in a mindful way. It's kind of related to mindfulness, getting into a meditative state or getting into a very focused state and relaxing and tuning out all the noise that we all experience every day in our busy lives, where things are hectic, may have a lot to manage, a lot going on, and we, may feel like overwhelmed at times and have a lot on our plate. And by finding a way to reduce the stress effect, we have various avenues. And what I was talking about last week was the use of music as a therapy. So basically treatment with music. And just an action like just going out into nature, going for a walk can be great for helping to relax your response and de-stress and this kind of thing too. So I guess today what I was thinking of talking about is related to why, a little deeper, why we do that kind of thing, why we want to use those kinds of therapies and why it's good for us, and what it is we're addressing. And I've talked about these kinds of things before, but I'm going to put it in a little different framework. So, one of the things that I find to be, let's say, not very well addressed generally in the conventional medical system that we have in the United States is adrenal function, and basically the response of adrenals to stressors in our lives, and that we do have these stressful lives that we're dealing with, and our body's response to those stressors is related to, there are psychological aspects of it as well, but there are very deep-rooted physiological aspects. And there are reactions that occur, like when we're truly in a high state of stress, things can kick in that lead to sort of internal reactions that lead to problems in some of our other organs. So our adrenals go crazy a little bit, and then we may have hyperthyroid function as a response, or it can be the opposite. It can be, the thyroid goes way down. It's like, so we can have and that's because of the interrelationship of the adrenals and the thyroid in our overall function, our metabolic function. And that's rarely addressed. And usually when conventional approaches are taken, they are addressing the thyroid, which is, the reaction of which may be actually a symptom of the stress that's been a problem that's led to this reaction. The adrenal function has changed that metabolic balance, and the body's response is to try and compensate by adjusting thyroid stimulation and therefore affecting thyroid hormone. And then there can also be, as a response to the stressors, immune responses. And this is autoimmune. This is where the body's own immune system starts attacking some of the functionality within the body. And that is one of the relationships that leads to things like diabetes as well. So we can actually contract diabetes due to stress. We can also contract thyroid disorders due to stress. And it's almost a direct relationship. And in response to the stress, our adrenal function is then tweaking the metabolism, and then we get side effects of that interaction. And these kinds of things are not dealt with directly. The problem is, conventionally, root cause is not what's dealt with. It's really more the symptoms. And so, I mean, it works great when we're talking about emergency medicine. And even in some of those cases, there are problems associated with it. But the addressing of symptoms means that we're not really getting to the root cause. Well, in my practice, A Path to Wellness, we focus on root cause. So, you know, my focus is to try to dig in, do whatever testing may be required, also symptomatically, you know, diagnostic approaches to break down what's going on in the individual's body that leads to whatever their disorder may be. And by doing that, I can actually differentiate the actual cause and treat it, and therefore the individual recovers in a way that is a natural and very nice recovery, as opposed to simply not having the symptoms, but still having the issues related to why those symptoms occurred. So that's part of the reason I then try to address some of these kind of side issues, like dealing with the stress being a root cause. Then I look at, okay, what happened after that stress? You know, why is the stress affecting this? And a fairly simple example that I can use to describe this is, for example, the effects on women's hormones. When women become stressed, just like men, they produce cortisol, okay? Cortisol is a molecular substance that is very similar in composition to progesterone. So when the stress happens, the cortisol goes up. That means the body is using those resources to produce more cortisol. As a result, the production of progesterone very likely goes down. And so that then affects the hormonal balance and can throw things off. Like women sometimes notice that, you know, when they've been stressed, they break out, they get acne, you know. Why? Because the stress has affected the progesterone level, because the cortisol shooting up meant less progesterone. So less progesterone throws the balance off. Now they're estrogen dominant. There's more estrogen going on in their body and not being opposed by progesterone. Estrogen, being a proliferative hormone, tends to create the development of things. And obviously there are the extreme examples like breast cancer and ovarian cancer, uterine fibroids, all these other things. But in less extreme examples, we have something like acne. So, you know, or their period may come on all of a sudden, you know, at an unusual time, or there may be significant cramping associated with that period, or bloating, or all of these other things that happen, heavy flow, etc. And I won't get too grody, but that's the kind of stuff we're talking about here.
It's like the time, I'm sorry, Dr. Chuck, when you had a show about, we had to get to the poop part of it.
Oh, yeah.
It became very poopy, that conversation.
Yeah. So this is bloody awful.
Yeah, exactly.
As they say in Manchester.
Exactly.
Right. So that's right. So I guess I'll give a shout out to the Manchester folks, right?
Fab Radio International.
Fab Radio International, yeah. So our partners in crime.
In rhyme. Our partners in rhyme.
Our partners in rhyme. I like it.
That's what we do.
Yeah. So I didn't know I was a poet.
You are. You're right. You do music. This is our little commercial. Yeah, break.
Right. So, but there's so much that is not dealt with in a very thorough fashion when it comes to women's hormones. And I'm kind of segueing, but all of these issues I just brought up, you've probably never heard a gynecologist tell you this, right? Or an endocrinologist even. And frankly, a lot of them probably wouldn't differentiate quite like I did. Let's put it that way. I'll try and be simple about it. But this is a response that happens because of the interrelationships of the systems within the body. And part of my understanding of this goes to my explorations in the current PhD program I'm working on, which is in behavioral medicine and health psychology. And the behavioral medicine aspect of it, there's an area of focus, and I've talked about this before. In fact, we wrote the big word psychoneuroendocrine immunology. When we deal with the interactions of the immune response, the endocrine system, the neurology involvement, and the psychology. And there's a lot of that. That's all going on when I'm on these things I'm talking about. So we have, we have that interaction of the adrenal response to the stressor. Well, what is that stressor? Well, it can be a psychological stressor or a physiological stressor. Okay, it can be stress on your body, or it can be stress on your mind, or basically, a psychological stressor. And we have lots of those. Obviously, it can be anything from a near miss on your car, or a crash, or something that at work didn't go right, or being overwhelmed by too much work, or even too little work, right? Where you're in fear of losing your job. Or there's so many stressors we have that are psychological, but we also have physiological stressors, And physiological stressors are very deeply rooted. In fact, in Maslow's hierarchy of needs, physiological stressors are at the bottom. Physiological needs are the foundation of our psychological makeup, you can say, or our behavioral makeup. So anyway, of our needs, the hierarchy of needs is kind of like a triangle setup where we have physiological needs, safety needs, social needs, esteem needs, and then when we're meeting those needs, self-actualization, to where we are thriving, essentially, as an individual. And we have these areas taken care of, and we're, going along pretty nicely. So at the root of all of this, or at the base of all of this, is physiological needs. So when our physiological needs aren't met appropriately, that can be a stressor for us. So for example, if we don't have a working toilet, the toilet's all plugged up, or if we can't get a shower, or these kinds of things, or we are confined into an area that's too small. Like some people complain about being in tiny little cubicles in office areas, where they feel really cramped, and this is a stressor in and of itself. That environment is creating stress for them, and it may be amenable to communication within the office environment, but as far as ergonomics go, it's not so great. And other types of needs along those lines, where, for example, we're affecting our musculoskeletal system, where we get, a sore lower back if we're sitting in a certain chair all the time, or if we're, or these kinds of things, or our physiology, our physical makeup, our musculoskeletal structure is actually affected by what our physiological environment is. Or for example, ergonomically speaking, if we're set up sitting at a desk where our computer screen is too low down, and so we're looking down like this, instead of up at eye level. Even that small little thing there that little adjustment can make a big difference in terms of having a sore neck, sore shoulders at the end of the day, this kind of thing. So all of these little types of situations accumulate, right? And they give us a composite load, we could say a stress load, right? And these stressors affect our physiological function, not just in terms of musculoskeletal, but in terms of the organs within our bodies, in terms of the glandular endocrine function. And so they affect our production of hormones. They affect many things that are interrelated with those kinds of situations. So the adrenal function, thyroid function, our brain, the interaction of stress in our brain. There's a part of our brain known as the hippocampus. The hippocampus is very much the memory center of our brain. And stress has quite an effect on the hippocampus. So sometimes memory function is affected by metabolic function, and sometimes it's affected by stress. And we can start having memory loss. This kind of thing can lead to problems in managing one's life. Being somewhat overwhelmed. And so we need a little timeout. And that's the focus of how we get through that is we can certainly pop a Xanax, like a lot of people do in this country, because they get all anxious and worked up, or, which is not a great solution because nobody has a Xanax deficiency, right? So what else could we do? Well, we could address these things with some relaxing nutrients that might be helpful. And frankly, a lot of people do have a magnesium deficiency. And magnesium is a relaxing mineral that helps with the synaptic activation, or the activity of our nerves. And it helps to calm the nerves. So that magnesium deficiency could be exacerbating the stress response. And then we add in things like caffeine, which hypersensitize the adrenal function and make things worse. So, addressing our needs in physiological ways by addressing deficiencies, typically, and also in psychological ways or even psychophysiological ways where the two merge. We're talking about mind-body medicine here, where we get into calming the mind as well as relaxing the body. And that's, again, the root of a lot of what I've been addressing over the last little while in terms of helping to treat through relaxing the stress load, relaxing the sympathetic response, which is that fight or flight response, and invoking the parasympathetic response, which is the relaxation response. And again, there was a There was a book by that name back in, I believe, the 70s or 80s, called The Relaxation Response, and I believe it was by Herbert Benson, who also did some other books on meditation and this kind of thing, mindfulness. And this was a Harvard MD, so he was breaking the mold with all that. Of course, that mold has been broken by other Harvard MDs like Andrew Weil, who got into plant medicine. He came from a background of not herbology. Let's see, it was plant science anyway of some sort. He was involved in plant science, and took that and went into medical school, and then came out of medical school basically preaching natural medicine and talking about how plants can do a lot for us. And I think he's done a lot for natural medicine in terms of helping the U.S. Society integrate it into lifestyles and that kind of thing. And he has promoted somewhat the integrated medicine approach. And, I think that's important, that these are good inroads. But there have been other great activities along the lines of integrating mind and body into the medicine. And one of the areas that we have to be aware of in terms of this evolution we're going through is the psychosocial aspects of medicine. And unfortunately, adding to the stress is quite often part of the treatment process, which can then exacerbate the results. For example, when people are hospitalized, it can be a very, very stressful situation. And unfortunately, what happens is they're poked and prodded and injected and all of these different things that are going on for data purposes to understand what's going on with them physiologically. But simple things like being able to sleep may not be addressed. And so a lot of people who are in the hospital go without sleep or are sleep deprived because of all the interruptions that are considered necessary to maintain monitoring of their progress. And in a lot of cases, those may be necessary. But there may be other ways of doing them as well, and there may be also other things that can be done that can be helpful in terms of creating an environment that is more relaxing to enhance or support recovery. And this whole aspect is something that, again, is not well addressed conventionally. The psychosocial aspects, the whole interaction with stress, the whole problem of the adrenal response. In fact, adrenals are rarely even addressed conventionally. And it is an aspect of dealing with the stress, and it's part of the root of the problems that occur as a result of that stress. It starts with the adrenal response to the stressors. And so that's part of what we're trying to address. The adrenal response, that fight or flight response, the sympathetic response, alters heart function, alters blood flow, alters brain function, alters our focus. There's a lot of aspects that are addressed there. It affects our memory, our cognition. So it's interesting. A thought occurs to me. I'm just hearing in the background a siren, and it occurs to me that even that, even a simple sound in the background like a siren, can be stressful for some, right? The siren, I don't know, evokes thoughts of emergency, um, you know, problems, trouble, these kinds of things. And for some who might be on the brink of a breakdown, especially, just hearing simple noises like that might be something that pushes them over the edge, you know. So creating a very relaxing environment for oneself is important, and certainly for patients as a healthcare practitioner, it can be a very important thing, which is part of why at A Path to Wellness we have music going all the time in the background, just to make a more relaxing environment and help enhance the treatment and the the response. So that takes us back to the whole idea of music as a therapy, music as a treatment. So I was talking about a little bit about how stress affects female hormone function. And it goes even deeper. For example, there are the precursors, which I've talked about in the past, to creation of estrogen, testosterone, and progesterone. And not only does the adrenal function affect levels of progesterone and cortisol, being an adrenal hormone, but adrenal response also affects testosterone. And adrenal activity influences a precursor to testosterone as well as estrogen, which is DHEA, dehydroepiandrosterone. That's an important androgen, and DHEA sulfite is actually the test that we do to see what levels of that precursor are available, and that is entirely produced in the adrenals. I think this is an aspect that's often missed and can affect people quite a bit. Now, take that thought, now transplant it to males who already have plenty of testosterone, especially young males, right? Who have lots of testosterone. Add a bunch of stress to that situation. So, you know, there's a reason we see a lot of anger as a response in young males. You know, we see that a lot of young males, at least in this country, are involved in violent crimes. You know, so you take a stressed young male who may feel somewhat isolated, who you know, maybe feels downtrodden in some way, like that they're not getting life's rewards, or who knows, with plenty of testosterone to fuel the fire, and a lot of them end up in prison, and a lot of them do the violent crimes that are so prevalent in our society. And so we have this interaction with adrenal function and testosterone or androgen function. And by the way, that is backed up by studies as far as the male population and the anger and the violent crimes. violent criminals tend to have elevated testosterone. In fact, I think it's in the 90s of percent of violent criminals have elevated testosterone. So there is definitely an interrelationship there between that violence, which can be rooted in anger, which can also be rooted in anxiety or fear. So the flip side of the fear is the anger, and fueled by testosterone, that can go a little crazy. And so we end up with violent criminals. And if we got to the root of these things, we might be able to actually reduce that population. So, this is obviously an interest of someone who's exploring behavioral medicine or looking into the physiological roots of psychological disorders, and certainly violent behaviors can be part of that, and they can be pathological, quite often are pathological. So, meaning that there is a physiological root to them, and that they have become a disorder, and then the individuals end up doing time, and quite often for having done some violent crimes. So stress is a really big deal. It affects so many things in our lives, in our body function, our physiology, and even our psychology. And when another example of this would be young women who are paired with somebody, a violent young man. I guess I'm typecasting. Obviously, it's not always a young man, and it's not always a young woman, and all this kind of thing. But I'm just using an example, and it's a pretty common example. So you take this situation where you have a young lady who may have a spouse who is either verbally or physically abusive. And that certainly is a very stressful situation. And it can have really serious effects on that woman's psyche, but also because of the psychoneuroendocrine immunology aspects of that, we have an interrelationship there. So we have the psychological response leading to a physical response, which is the adrenal function response or the fight or flight response. That young lady may be very stressed, may be very anxious, may be very depressed, may go through cycles of anxiety and depression, or even mania and depression, may very much appear to be bipolar when evaluated. If they go see a psychologist or a psychiatrist, that may be the diagnosis, they're bipolar. And yet, it may be their situation and the stress that's involved that's actually creating that appearance of being bipolar or being manic depressive is the old term. And this is something I do find fairly regularly, and in fact, a lot of research has been showing that there are interrelationships like that, and they can both affect and be affected by the physiology. For example, thyroid function can be involved in bipolar. There are studies showing that there's like a factor of 2.5 times as many women who are diagnosed bipolar having, I'm trying to state this correctly, having hyperthyroidism or having elevated T3 as opposed to the general population. So these women who have thyroid disorders are being diagnosed as bipolar. And yet the underlying reason for the appearance of that disorder is not psychological. It's not something they got into by way of having a poor upbringing or being in a bad environment, yes, but for other reasons. It's physiological that physiologically that they are having trouble, and it displays itself as psychological. But the underlying reason is more physiological, and it may be a response to other psychological issues, such as being in a violent relationship or being under high stress or things like that. And so taking a look appropriately at the levels, and I don't mean like with thyroid just looking at TSH, I mean looking deeply into, and by the way, there's plenty of studies as well showing that TSH is very much affected by stress, and therefore it's really not a valid way of screening people for thyroid disorders. Need to look deeper, and this is commonly not how things are done. Commonly TSH, the pituitary hormone, thyroid stimulating hormone, is what's looked at as a screen for thyroid, and it's often not accurate because what it doesn't account for is the effects of stress on those numbers, among other things. And so, we need to look deeper. We need to look at the physiological functions within the body that can be affected by stress, and that can also affect the psychological function. Generally speaking, when I'm dealing with somebody who has those kinds of issues, anxiety, depression, maybe even mania, or a lot of anger, these kinds of things, I look deeply into, okay, thyroid function, maybe adrenal, cortisol levels, look at progesterone, estrogen, testosterone, looking at how those levels are being affected and where they are. Look at other things that can be important to those kinds of responses, like if somebody is anemic, it can affect their oxygen carrying capacity, which can affect brain function. It can affect many things within the body. So there are so many things, and there could be a relationship with vitamin D, which is very much involved in the immune response. So here we have a connection to the immune response as well as the endocrinology, as D is a hormone. So we have a hormonal action going on with vitamin D, but we also have this interrelationship with the immune system. And there are many other aspects of it. Of course, I did a show once on vitamin D. The whole show was on vitamin D. So there are so many things that it's involved in. But so this can be a factor as well. And it certainly can affect depression. In fact, another thing that can affect depression is, as I mentioned earlier, the magnesium deficiency. Magnesium has been very well linked in studies to dopamine production and to depression when it's low. So, there are so many of these interrelationships that can be explored using natural medicine, looking at it, approaching it from the point of view of deficiencies and understanding those underlying deficiencies and their interrelationships with physiology, and therefore reflecting on psychology. So we have the psycho-neuroendocrine immunology, tying it all together again. So, I see these kinds of things fairly regularly, and people are having a really tough time because they're being treated for symptoms so often, and the root causes are so infrequently addressed. in the route that conventionally is being taken. And so it's a constant battle, and it's it's common for my patients to tell me that they were told they needed to be on a certain drug the rest of their life, and yet they don't. Most of the time, the root cause has not been addressed, and so once the root cause is addressed, then they can come off of those drugs. And I do kind of in a somewhat protective approach, both protective of the patient and protective of the practice that I do, and even protective of the practice that is done by the conventional folks. I do advise them that they need to discuss their levels with the physician who prescribed them. And, as they improve and as we see the effects gained and the improvement that is seen as a result of the treatment protocols that I'm using for them, then, wean off the drugs. So by addressing the root cause, we can actually do quite a lot of good work to help people recover and improve in all aspects, psychological and physiological. So again, the reason I'm discussing all this is to help folks understand the underlying reactions within the body and how these things all interact, and how it is important to address stress because of its effects and the damage that is caused by the stress load. So the mindfulness practices help us quite a bit in both tuning out a lot of that stress and tuning in to a zone that takes our focus onto something innocuous and hopefully pleasant and relaxing, and offsetting the stressful lives that we lead. Anne-Marie, can you think of any other examples that you've experienced of stress or these kinds of things, that how it's affecting people's lives and your own life?
I'll give you an example. I don't want to say this. The energy around us is crazy right now. We just played a game called the Exquisite Corpse Games that is based on energy. Yeah. And there were a lot of factors that were going on that could affect the energy. Unfortunately, recently, it's just so hard to talk about. The way the energy forces, what everything that's going on affects people, and the stress it brings to people, it's different for everyone individually. Yeah. And you never know what somebody is thinking. Recently, this week, somebody passed away from the art community, and I don't know this for a fact, but however the person died, passed away, it was because of stress. The way, at the end of the day. Stress
kills.
Stress does kill.
It really
and the
does.
Worst part about it is all of us around never even realized how much stress that person was under.
Right.
So how do things affect? I mean, it's hard. You can't judge a book by its cover.
Right.
And you really have, and even those, like myself, when I'm going through a depressive state, that which is, created
a
also.
Difficult time.
Yeah, and then that brings on more stress, because the way you deal with problems at that time, you envision things totally differently than when you normally would, probably when you're under a little less stress.
Right. You may feel more isolated And that's when it's really important to have a support network, have people around you who you can talk to and share these thoughts and feelings with, and and understand their views on things, so you don't feel quite as isolated, for one.
But here's a problem that I also saw with that, and that's why I continue to work with you, and I believe in what you do so much, because unfortunately when people are going through that, they're going to go to whoever they feel is their friend, the person that's closest to them. And you really don't know all the baggage that other person has.
True
and
enough.
People, when they tend to give advice, they can only do it based on their own personal experiences.
That's true.
So therefore, now you're depressed, now you're stressed, now you're going to those that you think, I have to have an outlet somewhere, so let me let it out here. And unfortunately, that even brings on more stress. You don't realize it, because now you're coming and spilling your beans to this person, trusting in them. Come to find out, the advice that they're giving you, that you're believing at that moment, just added on more stress.
Right.
So the point I want to make with that also is, yes, we need to have a good support system, but I really think that you need to start out with a good, maybe professional, when you get to that point where you can give, which is in total unbiased opinion and based on facts, scientifically and everything else, and studies that can help that person. So
absolutely.
Does it seem like I just went through something? You asked the right question to the right person right now, because I have seen it real recently, and the cause and the effects, and the cause and the effect. And we have, here's what and it's not a plug for the game. I have been living my life through this game for the last 9 months. And the reason why I believe in it so wholeheartedly, because the object of the game is to show people what happens when like-minded people get together. Energy cannot be destroyed, and that's a fact. So the way I envision it is, there's dark energy and there's lighter energy. When I'm stressed out, and now let's just put it in a visual. So when I stress myself out, I'm creating that dark energy. I'm not even, let's not talk about hocus pocus people or spirituality and all that. Let's just get to simple terms. And so I've broken it down into, when I'm stressed, it's darker. When I'm feeling good, my energy is lighter. So I have two choices: either to feed into the dark side and totally kill my body and make it become totally toxic, or try to take that energy that's bombarding me and bringing me down, which I look at it as depression and all those other elements, and try to bring that energy to the lighter side, the clear side. And how do I do that? By talking to Dr. Christopher Jackson every week and hearing his show and listening to some facts. For example, I am very low in magnesium. Once again, today, you hit it right on target, and I'm aware of that. And again, I'm having to, because I don't do it consistently. See, here's the problem. I listen, I learn, and I know, but now I drop the ball. And that's where you come in again. When I hear these things, when I hear some factual information that resonates in my brain, that allows me to comprehend without other people's preconceived ideas.
Sure.
Bring it around full circle to that support group.
And often one of the problems with it, although you need a good support network, you need to have a good non-judgmental support network. I think that's important to mention. So, you don't go to people who are going to judge you or put you down or tell you you're in the wrong so much. I mean, unless it's needed, like, if you've screwed up, okay, you've screwed up, but to put yourself in a situation that's going to make you feel worse is not a good choice, right? So you want a support network of people who will be positive, validate you, be supportive, be there for you, as opposed to on your case, and as far as energy goes, yes, there is definitely positive energy, right? We have people who are positive and have good energy, and we know it when we're around them, and we feel good around them, and you know, we like hanging out with them because we feel good about them, or good about ourselves, or just enjoy our time, or, you know, come out of it energized and feeling good. That tells you something. If you're feeling good after being with somebody, right? You're feeling energized. You're feeling positive. Those are the kinds of people you want to be around, especially as your support network. I mean, you know, if you're working in an environment and you have some negative people, okay, you got to deal with it, right? But they're not, just don't make them part of your support network, and don't start sharing your inner feelings with them. You know, find people who are safe and appropriate and supportive and validating and these kinds of things to be part of that support network. So, and that is part of de-stressing as well, to be able to share. I know, especially, I think men tend to, and I mean, this goes back to men are from Mars, women are from Venus, John Gray. But some of what he talked about in that was how men are, you know, not the sharing people. We need to go into a cave sometimes, and it's okay. And, you know, men are looking for generally appreciation, whereas women may be looking more for understanding, you know, being understood. So with women, it's not about fixing the problem, although it may be more supporting them while you help them figure out how to fix the problem, you know. And with men, it's more about problem solving and fixing the problem, and you know, and you know, stoicism and this kind of thing. Not, you know, not so much about the sharing as the troubleshooting. And it's a little different way of looking at things, and maybe with men's groups, having support and validation may be a little different in the way it's done. But we all need this kind of support network to help us deal with our situations, and especially, like, for example, again, back to, you know, the model of the young lady in an abusive relationship, who feels isolated, doesn't have a lot of friends, maybe, this kind of thing, needs to really develop those friends, needs to have that support network to feel less isolated and to be able to handle that situation appropriately. And I'm not saying any specific solution. I mean, it can be anything from kick the bum out to call the cops, you know. But you know, having a good support network to be there in times of need is certainly important. So, you know, the Beatles song, I get by with a little help from my friends, right? So, and positive energy is really a big deal. So, yes, if you're in an environment where there's a lot of negative energy, a lot of negativity, a lot of kind of a negative point of view, landing on negatives all the time, that's going to deflate that energy. It's going to, you know, it's going to convert into bad stuff. So we want to help it convert into good stuff, that kind of thing. Yeah. So, and you know, the kinds of activities Anne Marie's talking about can be very cathartic. You know, we can convert a lot of our our energy into positive results, right? It's kind of like converting energy into matter and matter into energy, E equals mc squared, that whole Einstein thing. We're taking the energy we have and doing good things with it. And this is, I guess, part of what motivates those of us in the helping professions. You know, we take our energy and we convert it into helping others be better off. And it's certainly motivating when people's lives are improved through the kind of work that we do at A Path to Wellness. And so just want to say that big word one more time, just to reinforce that it's all interconnected, right? Psycho, neuro, endocrine, immunology. If we're in a bad state, if we're in a stressful condition, guess what? It's going to affect our endocrine system, which means it affects our metabolism. It's going to affect everything from sugar management, glucose management, sugar levels in our body, to brain function, to memory, cognition, to our immune systems. We're going to more easily catch colds. You know, we may be sort of walking on eggshells, maybe a little nervous at times, maybe anxious, all these things when we're under a lot of stress. So that's the whole interaction, psycho, neuro, endocrine, and immune interaction, right? Neurological, psychological, endocrine, and immune response. So relax, find something very relaxing, pick up a hobby, play the guitar, pick up a ukulele, tiptoe.
Exactly my point.
Yeah, tiptoe through the tulips, right? Ukulele. What was his name? Tiny Tim. Yeah, remember that? Yeah. But you know, find something that you enjoy doing as a hobby to take you away from all that stress. Take some time out. Find something that you enjoy to get you away from all that and to deflate all that negative energy that you may pick up and to relax. So that's my prescription. Thanks for listening. You've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And if you want to find out more about my practice, A Path to Wellness, you can go to the website, www.aptw.net, short for A Path to Wellness. And see what we're all about. And then you could also reach us at the office at 727-329-9637. And thank you very much for listening.